Hi, everybody, and welcome. Thank you so much for joining us today for our webinar supporting preteens and teens with PMS and PMDD. My name's Imogen. I'm the social media and community manager here at Evelyn Health. And today's session will be all about opening up that conversation earlier, helping parents, carers, and young people understand what's normal, what might need more attention, but most importantly, how to find the right support. And we're really excited to be teaming up with Luna, the number one wellbeing app for teen girls, to host this event. I will let our two incredible speakers introduce themselves, but before I do, I just want to say there will be an opportunity at the end for a Q&A session. So please feel free to pop your questions into the Q&A box or the chat as we go, and we'll do our best to answer as many as we can at the end of the session. And once again, thank you for just spending your evening with us. And I really hope that you find this educational and you come away learning something new. And this is such an important conversation. So I will now hand it over to Jess and Dr. Katie to introduce themselves. Thank you so much.
Amazing. Thank you so much, Imogen. And yes, thank you everybody for spending your evening with us. We're very excited to be here. I'm Jazz Stothart, one of the co-founders of Luna, which is the trusted health and wellbeing app for preteens and teens to support them throughout adolescence. You can think of us a bit like a digital big sister in your pocket. And on Luna, we cover puberty and everything in between. And of course, this includes periods, PMS, and PMDD too. We feel really passionately about making sure that teens get access to reliable, trusted information that makes them feel empowered to have conversations with doctors and their parents too. Now, Luna is co-created with experts like Dr. Katie, who joins me today. Dr. Katie is a consultant paediatrician with over 20 years of experience caring for children and adolescents. Dr. Katie specialises in adolescent holistic health, paediatric rheumatology, and gynecology, and is passionate about providing expert, compassionate, and age-appropriate medical care tailored to the unique needs of young people and their families. Dr. Katie works at the Imperial NHS Healthcare Trust and privately at the Mayfair Clinic too. We are also extremely lucky to have Dr. Katie as Luna's chief medical advisor, overseeing our processes, strategy, and so much more. As Imogen alluded to today, we'll be focusing on how to support teens with PMS and PMDD, how to spot the signs, support them emotionally and physically too. So to begin, this is 12-year-old me and my co-founder, Joe. Me on the right, I was very embarrassed to talk about periods. I didn't really understand my moods or what PMS was or why I was feeling a certain way at certain times. Nobody really explained any of this to me. Now, my co-founder, Jo, on the left, she actually really suffered with very painful periods as a teen. She was a young athlete and she ended up missing school and sports as well. She just thought this was completely normal. Back then, a long time ago now, there was little to no accessible information on periods, which meant we had no answers and little support. Apart from maybe the one or two biology lessons or PSHE lessons, which very much taught us the science behind periods and not really anything practical to help us cope with them. And so we very much relied on these, the magazines, usually going to the back and reading the agony aunt stories. But as you can see from the cover of these magazines, they were very much about beauty, how to find your crush, having cute hair, quite surface level stuff. PMS would have never been featured on the front cover of these magazines. It's not exactly a sexy topic as these magazines would have called it, which just left a huge gap in our own education and knowledge. Now, today in 2025, these magazines don't exist, but the same questions, curiosities, and issues do. In fact, 85% of teens still say that their period education at school isn't good enough. And as such, 1 in 2 teens go online for health and well-being information before speaking to a parent. Today's teens are entirely dependent on online sources for information and answers. And what's happened is we've gone from an era of like no information to this era of misinformation overload. You can see just a few comments on the left that I found from just quickly searching on TikTok PMDD support, offering each other advice, questions. There's even one in the bottom left corner where someone's recommending to eat raw carrots to help cure this. So it shows that teens are curious. They want information, they want support, but they're not always getting accurate information. In fact, it's leaving 1.3 billion teens in the world at risk of looking online for answers to the questions, but seeing misinformation or resources that are not always age appropriate or accurate. So, this is exactly why we've built Luna, to give teens a safe space to be curious, to ask questions, and to feel empowered. We are all created with medical experts like Dr. Katie, and there's also a very simple period tracker on the app too, to help teens start to form healthy habits, to understand their hormones and what's going on with the changes of their bodies. And our period tracker is made just for teenagers, not their mums and not their aunties either. There are no open forums, no peer-to-peer contact, and it's all geared towards teenagers. So we are a holistic app. We cover periods, mental health, skin, body positivity, PMS and PMDD support too. And we built Luna because it's the app we wish we had when we were younger. And so many of our friends wish they had it too. Now, today, over 150,000 families use Luna, and they vote in polls and provide us with insights in real time. Some of them we want to share with you now. When we asked our teen community how they feel when their period comes around, over 70% of them picked words like irritated, tired, unwell, or stressed. We've also received over 60 questions from struggling teens in our app. And 1 in 4 questions is about periods. And if we drill specifically down into PMS and PMDD, we hear everything from, is what I'm experiencing normal? Do I need a formal diagnosis? Is PMS or PMDD genetic? How can I handle it all? Such a range of questions. Now, clearly, we are going in the right directions in terms of education and awareness about these topics, because they are definitely more informed than I was when I was a teenager. But now it's all about making sure that where they are learning from is giving them accurate and trusted advice and information, as our teens today are exposed to information everywhere. So let's now dive into how we can give our teens practical and safe coping tips so they're not as reliant on the sources like Reddit, ChatGPT, and TikTok, which has a lot of unfiltered advice. So over to Dr. Katie now to take you through how we as parents and caregivers can support our teens more.
Thanks, Chaz. So, and thank you for the introduction. Yeah, I'm a general pediatrician, but I see lots of girls in a special sort of adolescent gynecology clinic that I started up because I was having a lot of referrals of girls with troublesome periods, a lot just not really understanding their bodies, and what was normal and what was abnormal. So we're going to touch on that as we talk about PMS. So PMS is incredibly common, and most women will suffer from it in some form or other. So it stands for premenstrual syndrome. It's common, as I said, it causes psychological, physical, and behavioural symptoms in the week before a period. And it is due to the fluctuating hormonal changes. But PMS is not PMDD, and it actually should be sort of tolerable or managed by simple measures. So these are some of the symptoms that young people, or all women, but particularly young people, get. So physical symptoms such as headaches, bloating, breast tenderness, tiredness, changes in appetite, breakouts or oily skin, and greasy hair. But again, just thinking about that list of symptoms, they often do happen throughout teenage life as well. So, it's good to sort of bear that in mind. So there are other things that can cause those symptoms. But typically with PMS, you have mood swings, feeling low or irritable, feeling upset, anxious, or emotional. Again, the problem is that these are all features that are seen throughout the adolescent time. And what I will say is that during adolescence, it can take a while for periods to become regular. So What's happening is that the sort of reproductive system and the way that messages are sent from the brain to the ovaries is quite immature. And it takes a while for that to start to work properly. And what I mean by working properly is that's when hormones are released regularly in a cyclical way. So to begin with, hormones are released in a quite haphazard way. And so that means girls don't ovulate every month, and they'll have months where they will not ovulate, and then they will experience probably some heavier bleeding in the next month. So they get erratic, irregular bleeding, and it's all a bit all over the place, and it can take actually up to about 5 years to settle down. But what can you do to help your daughters who are experiencing PMS? Well, one thing that we know helps is exercise, and that doesn't mean, running a marathon. It can be very simple things like just walking to school instead of getting a bus, or, walking for a bit of the journey to school, going with you to walk to the shops. It doesn't have to be strenuous exercise, but anything you can do. Healthy eating. And what I would say, particularly around healthy eating, is making sure that your daughter is getting 3 meals a day. So I see many, many teenagers who are not having breakfast. And then they sort of don't have that much lunch at school because, they're too busy, or the queue's really long for lunch, or, there's all too caught up in sort of girl chat, and don't have time. And so then, after school, they go and just buy sort of rubbish, and lots of junk food. So trying to sort of prevent that happening by having breakfast. Doesn't have to be big, some, banana, granola bar, piece of toast, but just something to start the day. And then, particularly around their period, they might have sort of cravings, particularly we know more for sort of sweet food. And so thinking how you can manage that, not kind of eating loads of chocolate because actually it ends up not making you feel much better. But, thinking of, having more fruit around that time, or just making it just sort of forward planning and thinking about it. Um, and obviously exercise and healthy eating can be very much led by example. So, should be doing this as a family, doing it together. They shouldn't feel that they're being forced to do certain things that no one else in the family is doing. Sleep is really important, and I say, this applies to all times through adolescence, but particularly at the time leading up to having a period. So making sure that the time that a young person goes to sleep is consistent. So it's not sort of 9 o'clock one day, 12 o'clock the next day, 1 o'clock the next day. So just trying to keep around the same time. I'm within an hour or so, and sometimes I know that's not possible. Remember also that a teenage sort of circadian rhythm, so time when they do sleep, is different from when they were younger. So when they're saying they can't get to sleep before 11, they probably really can't, because again, the neurotransmitters and hormones are being released slightly differently during this age. So that's okay. If they need to go to bed a bit later, that's fine, but kind of wind down during the evening so that sleep is easier. Thinking about sleep hygiene. So, and that involves a sort of winding down, not being on screens in the hour, at least an hour before going to sleep. Making sure the room is dark, and quiet. Sometimes people like to use eye shades and earplugs. So anything you can do to make the process of sleep be easier. PMS can be helped with simple painkillers. So that's paracetamol and or ibuprofen. Ibuprofen tends to be a little bit better for this type of pain. And some people don't like to take tablets at all, medication at all. So, you can do things like hot water bottle, massage, anything that is soothing. And then period trackers. So period trackers are really helpful in allowing girls to really understand their own bodies and kind of what to expect during this lead up to having their period. So, and then, what's the purpose of that? Well, it helps them be able to plan. So, organize their life to accommodate for the changes that they're going to have or that they've noticed. But they might notice that, their skin is worse in the lead up to their period, and just all those things that I said before, breast tenderness, feeling bloated. But it's really helpful for them to really be able to recognize that. Um, and for these reasons, so being able to plan, really good. So if they know that the time before their period they're just totally exhausted, then maybe they don't do those extra activities that week. Or, if they're going to arrange some social event, avoiding that in the time before their period. And then managing their workload. So if they're, having to think about revision, making that week a slightly less onerous week when it comes to revising. So it can be really, really helpful. And that's something that often girls need to be slightly steered towards and helped with that. Um, and then, of course, what it really does is indicate what is normal for that young person and what is not. So knowing when they need to go and seek medical attention. And that's really important, actually, because this is such a big time of change in many different aspects of their life. And it is a time when they really need to start to understand what their body, what the feelings kind of mean, and then sort of being empowered by that knowledge, actually. So when you know these symptoms mean I'm going to have my period, that's really helpful. And when you know that it's slightly abnormal, that is quite empowering to say, okay, this isn't right, and I should go and seek medical attention. But also being aware of hormonal changes and the impact on their body, talking about periods and how the periods change or how they feel during their cycle is very good preparation for adulthood. So just not having the sort of stigma around it, being open to going to the doctor and talking about it. And I must say, when I see girls in clinic, well, it depends on their age, but often, particularly the younger teenagers, will just want their mum to do the talking. And that's totally understandable. It's embarrassing and they really don't want to do it. But I really sort of start to encourage them to just talk to me, and tell me exactly what they feel. And sometimes, more often than not, actually, I see them on their own. And just as I sort of get to know them, just really encourage them to start to feel comfortable having that kind of consultation, because undoubtedly they're going to have these conversations as they get older. And then, of course, raising the red flags for serious concerns like PMDD. So sort of knowing, as I said, what's normal, what's not normal, and when they need to seek help. So PMS, as I said, is really common, and can be managed by simple measures. But when that's not possible, then it can become something called PMDD. And PMDD is premenstrual dysphoric disorder. So it's a really severe form of PMS, that really causes such emotional and physical symptoms that young people can't carry on doing their normal daily activities. And in fact, I saw someone just today who said she literally cannot stop crying for 3 days. It doesn't matter what anyone says or does, she just cannot stop. And that means she can't get out of bed, she can't go to school. I mean, it's really debilitating. And again, it's not just the sort of emotion. Well, it is more of the emotional stuff, but there still may be some of the physical symptoms as well. But there is an absolute overlay of this dysphoric, so just not seeing any joy in anything they do. And it's almost like they describe it as a black cloud literally coming down, and not being able to lift out of it. It does affect around 1 in 20 people who menstruate, but remember, this is all women. You can imagine in teenagers, it's a little bit harder to sort of untangle from what else is happening during the adolescent period. We know that mental health problems peak at around 14 and a half years of age. We're currently seeing a huge increase in mental health problems. And this is due to lots of sort of external factors, that's a whole other talk. But so it makes it a little bit harder, and it probably makes the diagnosis of PMDD in adolescence take a little bit longer. But what's really important is that young people definitely need medical treatment to manage PMDD. This is not something that can be managed without medical advice and treatment. And so what does it look like? Well, it's all those same things that I described in PMS, but it's accentuated sort of 20-fold. So everything is worse and almost unbearable. So there will be physical changes, but the breast tenderness is, really unbearable, unable to tolerate that kind of pain. Lots of sort of muscle aching, and sleep particularly can be very disturbed. And then, as I said, the sort of emotional toil is huge, and often, more often than not, actually having feelings of suicidal ideation. And many of these girls also do self-harm, because it just brings out such a huge sort of emotional uptick. So, does PMDD need a diagnosis? Well, it does actually, because as I said, it needs to be distinguished from PMS, and that's really important. So it goes back to girls really being able to understand what is normal and what is abnormal. But it does need diagnosing because we know there are medications that work. But in order to get to that point of it being diagnosed, we need to really see what those changes are. And so, although for adults, a diagnosis can be made after sort of 2 cycles of showing these extreme emotional changes and physical changes, for adolescents, it can take 3 to 6 months of sort of continuous tracking. And it goes back to that point where I said hormones can be chaotic during those first few months or years even of having periods. Obviously, if you're not ovulating every month, you're not having the same surges of hormones every single month. So there may be some months where you're not getting such extreme symptoms. So that's why it's important to be tracking for a longer period of time before you can definitely go to a doctor and say, I think this might be PMDD. So we also know that the age of starting periods is getting younger. So, I'm seeing girls in clinic who are starting their periods as young as 8. But the average age is usually around 12. And the point here really is that the conversations need to start early. So girls need to know that they may well experience some mood changes with their periods, and that might start quite early on. And again, just tracking how you feel during those times, and the other symptoms you're having, is just really important. And tracking these symptoms, of course, is it starts a conversation. So it's actually a really nice way to open the conversation with your daughter. So to be able to look at a tracking app together, see what you can put on that app. I know the Lunar app you can put in all your other symptoms. So if you're having the headache and breast tenderness and tummy ache, and that can all be logged in the app. And so it's a great way to sort of start talking about it, and particularly having those open conversations about mental health. So, how do you do this? And what should you be talking about? Well, I've really said what you should be talking about is really how they're feeling, but doing it in a really sort of non-judgmental way. And I know that sounds obvious, but as a mum myself, I know that when you're in that state and we're just getting very irritated with each other, it's quite difficult not just to turn and say, why are you being so irritable? But more to, just check in. I've noticed you're being a bit more irritable. I've noticed you just seem a bit low. Tell me what's going on. And I've also noticed it often happens before your period. Do you think it might be related? Are you tracking it? Should we look at trackers? So, open the conversation in that way. And you can relate it to yourself as well. Sometimes you can say, I remember when I was your age, I really struggled with this, if you did. And I found it difficult, and I didn't have someone to talk to about my mental health. But as I got older, I know how important that is. So, and I think also as mums, we worry about asking those difficult questions. We worry about asking about sort of self-harm, or if they've ever felt suicidal, and that feels really difficult to ask as a mum. But actually, I think it's important. You can say, I know some girls your age do self-harm. Have you ever thought about that? Um, or have you ever felt so low that you've thought about kind of harming yourself, or, you know, doing anything bad, I could sometimes say, or, just think, it's okay to say it. Saying it does not mean that you're going to put ideas into their head. And then where do you have these conversations? So I think to remember that this is a sort of continuous conversation. You don't have to say it all in an hour and get it all over and done with. It's good, as I said, to start young, to find something, a sort of hook to have it on, like the tracker, or sometimes if you're watching TV, that's a great that you're both looking at the TV, but there might be something that's come on during a program that can kind of initiate a conversation, can be really, really helpful, sort of in the moment. Or often in the car, if you got the radio on, something might just prompt a conversation. Walking is also good. So any situation really where you're not face to face, it just feels easier, to just start to nudge to have those conversations. But I think where it sort of goes wrong is when you kind of set it up. You're kind of like, this afternoon, I'm really going to do it. I'm going to have that conversation. I think that's often, it just doesn't work well like that. And it's amazing how young people kind of sense that. They sense, oh, mum's about to have that big talk and I really don't want to do it now. So it is about being patient and finding the right time that feels right for both of you. So, sort of patterns that you can look out for that might indicate there's something that is serious, like PMDD. So, um, and this is, repeating ourselves a bit, but just that consistently low mood, 7 to 14 days before the period. So it's actually during the luteal phase of the period. So, if that is consistent, if you notice it consistently, sleep disturbance is, as I said, a big problem. And I mean, there are lots of apps for that at the moment. I don't know. I have slightly mixed feelings about that. I think monitoring sleep on an app can be helpful, but it means more sort of online stuff, I think, and can also really raise anxiety. But again, it's about checking in. What was your sleep like last night? Were you up much? What time? Just being curious, and checking. I mean, you don't want to be standing outside the door and just and watching, but just noticing if the lights are on. And as I said, asking. Um, and I think it's quite hard actually for young people to know what is a good sleep and what is a bad sleep. I think a good question to ask in the morning is, do you feel rested by that sleep? Do you feel ready for the day, or do you just still feel exhausted? And then, a school absence is something that shouldn't be happening. Periods should not stop girls going to school. And I have to say that many of the girls I see in clinic are missing at least 1 to 2 days of school every month. And that has a huge impact on their education. And there is absolutely no reason to miss school. So if that's happening, you should definitely seek medical advice. So how do you get to a diagnosis? So really importantly, as we've said, use a tracking app of some sort, and linking it to the symptoms. So not just when the period is, but noting when the mood is changing, the physical symptoms, and then obviously putting in when the actual period is. And as we say, you need at least 3 to 6 months of data to be able to take to a doctor. See a GP and take that record with you. It's so helpful. I honestly, so often in clinic, when I see girls and I ask about their periods, they cannot tell me when their last period was, or the one before that, or how long that, there's a lot of information that I just don't know and they've forgotten. And that delays treatment. So actually having that there and then at the appointment is unbelievably helpful. And really not downplaying it. I think, oh well, it's a fine line, isn't it? You have to encourage your daughter to really talk about the impact, but also there is a lot of, this could be PMS, which is normal. So it's sort of finding that balance. And again, the tracking symptoms and signs is going to help with that. And then this is not, it gets diagnosed and that's it. This is a sort of something that needs continuous support. So, all the time, it's a really difficult thing for a girl to have to manage. So checking in with them all the time, and giving them as much support as you can, going back to all those sort of healthy lifestyle things that I talked about at the beginning. So the real focus on diet, nutrition, I should say, healthy nutrition, plenty of sleep, exercise, and then just being open to discussion. Um, and I've jumped the gun a bit because I've just pretty much said what's in this slide. But actually, what I didn't say was about structure. So actually, teenagers really benefit hugely from structure. And it's something I think that's really underplayed. And, I often find that when I see teenagers who are in huge sort of distress from a mental health perspective, they have lost all the structure in their day. So they're sleeping in the day, they're eating at all different times of the day. And one of the things to help them is to reverse that and get some structure. And what you might find though, once you've used, or she has used the tracking app and you've looked at that data, the structure might have to change during that run up to her period. So that again is very useful, isn't it, to go back and be able to adapt that structure in order to help her. As I just said, so thinking about diet, sleep, and stress, any sort of mindfulness that she can do to help her, or things that she just enjoys to wind down. Everybody is different, but finding the thing that works for her. Supplements, so particularly vitamin B complex, zinc and iron, and Evelyn does the supplement as well that supports PMS. And then education is powerful. So actually really learning about their bodies and about the changes during this period in their life, but trying to avoid the misinformation. So I think also as parents, we don't realize how much exposure young people are having to misinformation, like just constantly. And so really helping them with that and talking about it, but making them aware that not everything they're reading online is true, and steering them towards validated information such as Luna. And then of course cycle and mood tracking, as we've discussed.
Amazing. Well, thank you very much, Katie. I think we've come to the end of the slides. We have got a few questions to follow up with that we've had from teenagers about PMDD and PMS that we want to ask you to help any parents or caregivers respond to these kinds of questions. But as we're going through these, would love to encourage the audience to pop any questions in the Q&A box, and then we can get to these afterwards. So the first question we get in quite a lot is PMDD genetic?
Yeah, well, actually, there is a genetic component. So, absolutely, it can run in families. And there have been various studies looking at twins, actually. So, that's how we know that it is genetic. But that said, it does not mean that if you have it, your daughter will have it. So remember, they've only got 50% of your genes. And something I see a lot is um, sort of mums, and I know it's not, I can see why this happens, but mums sort of projecting what happened to them onto what their daughter will experience. So I have a lot, I had really heavy periods which were impossible, hormones didn't work for me. Everybody is different. And I'm sure, when mums were teenagers, they had different sort of external factors and pressures on them than girls do today. So, it's really worth bearing that in mind. But yes, there is some genetic sort of influence on this.
Great, thank you so much. Okay, the next question, which we see a lot on Luna, is around staying motivated to track my periods and how they can get better. Any thoughts to any parents, mothers, fathers, or caregivers out there who are really trying to encourage their
Yes.
daughter to do this?
Yeah, well, I mean, it's the first sort of few weeks that are the hardest ones, isn't it? Once you get into the habit, it gets easier. So I think at the beginning, perhaps it's something that you can do together, or checking in and seeing if she's done it, without nagging. Fine line there. Having reminders, and I think again with Luna, you can get a reminder to track your period. Um, and actually, getting in once you got to a certain stage, there's lots of positive feedback when girls realize that there is an association and they can see that. That's really helpful. It's real that sort of positive reinforcement. Oh, this actually is related to my period. So yeah, I think that's a few things. It will get better.
Definitely. Gosh, if only someone told me when I was younger that 7 days before I would not want to go to the gym, and it's not that I'm lazy and feel really tired.
Right, yeah.
Okay, the next one is I'm scared to go to the doctor. What will the appointment be like if I'm going with sort of PMS or PMDD or worries about periods in general?
Mm. And I think, this is only natural. It can be it's a fearful thing going to the doctor, or it can be, it shouldn't be, but it is. I think it can be made less fearful by having these conversations early on,
Mm.
and again, sort of normalizing things. Explain, doctors are there to help and to, really manage these symptoms. And it's a two-way thing. We need to go armed with information so that we can get help back. I will say that uh, many girls who come to see me think I'm going to do a sort of gynae examination, and we don't need to do that with teenage girls for things like this. So I think stating that at the beginning is really, really important. So if they're going with problems around their periods, there is absolutely no need for a doctor to do any examination of genitalia.
That's a really good. Oh, sorry, didn't mean
So
to.
go on.
You
So go
going?
on.
I was going to say I've actually just quickly opened the chat and the questions,
Mm,
and maybe this is a good follow-up question, which is who can diagnose PMDD? Is it a psychiatrist or a gynecologist? So I
mm.
don't know if you could describe the flow of what happens a bit to the answer that you just
Yes.
there.
Yeah. So it wouldn't be a GP, because this is quite a specialist area actually. And um, so the GP would obviously see what they thought and whether this was PMS or PMDD. And if they're worried about PMDD, then they would it does depend on the age of your daughter. So if they're young, so younger than 16, then they would either refer to a psychiatrist or to a general pediatrician, or a general pediatrician with an interest in gynecology. So it's not straightforward, and it also depends where you live and which sort of specialists are in your area. I'm quite a rare person because there aren't many pediatricians who do gynecology. So gynecologists usually just see 16 years and above. Um, so the answer is I'm making this very long-winded. It varies. It can be either a psychiatrist or a gynecologist or sometimes a general pediatrician.
Thank you so much. You're a rare breed, Katie, and we're very lucky to have you on board at Luna. I'll keep going with these team questions, but please do keep popping your questions in the chat. Um, this is a great one. So we hear this a lot. Will I be more likely to experience PMDD if I have ADHD and or autism?
Mm. So I just recently looked at the last couple of years of all the patients I've been seeing, and nearly 10% of the patients who are all coming in with troublesome periods had some form of neurodiversity. So it's much higher than the normal prevalence of neurodiversity. So I think there is something in there. So this is anecdotal, and there really aren't studies on this. But I think young people with neurodiversity perhaps are more sensitive to some of the changes they're experiencing during their menstrual cycle. I can't say a definite yes, but it is likely that if you are neurodiverse, you are more likely to have PMDD. And so it sort of brings me to the point of, if your daughter is neurodiverse, then all that I've said about these conversations and talking about it are even more important. It's important anyway, but even more. And you might find they are just finding managing their periods more difficult. And there are certain ways around that and to help them. But I'd say first and foremost is really being able to start those conversations and understanding that they might be finding it a bit more difficult.
And then the last question is, if I get triggered by something that upsets me or makes me angry, how can I calm down in the moment? So any tips for parents who might be having to deal with this at the moment?
Yeah, and I think, this is a really difficult time, and with and without hormones going on. These young people are living in a society that's got lots of things wrong with it. They're exposed to so much information online that they're having to process and understand. They've got their bodies changing. They are having to sort of make relationships. They're starting to have intimate relationships, and they have public exams looming. And most importantly, I think it's that sense of the unknown. So they don't know where they will be, what they will be doing in a few years' time. And that's really, really difficult to manage. And so it is likely that they do get upset and really sort of flip out and have a moment. And it's very difficult when you are a busy parent trying to do everything you can to help them. So everyone does this slightly differently, but in the moment, take a deep breath. You can do the sort of breathing box exercise, or say that to your daughter. Hang on, let's just both calm down. You can de-escalate things by saying, just imagine a box, breathe in as you go up the side, hold your breath along the top, breathe out as you go down, breathe in, and it just slows things down. And if they're really totally sort of losing it, and we do see actually young people on the ward who they just cannot sort of contain their anger. Stepping back, give them space, be silent, that's fine. And if you need to, walk away. Just say, I'm going to go for a bit of a walk. I don't want to talk about this now. Just have space. Just don't react in the moment.
Great. Thank you so much, Dr. Katie. So just before we head into the Q&A, there is a discount to the Luna app for any of the listeners here today. So we're giving 25% off the annual membership. So that's access to the teen and age appropriate period tracker, unlimited anonymous questions and content. More information will be sent out after this webinar about the app and how to access the code, or you could take a quick picture now. And then Evelyn have also given a discount code as well for their products too. And we'll also be sharing more information about that in the follow-up comms as well. Both are live until the 14th of October. So quickly moving on to the questions in the Q&A. We've had a question, Katie, around what medication is typically recommended?
Yeah, it's a good question. So Again, it will vary a little bit. Probably on symptoms, and also who is seeing your daughter. I mean, two of the main drugs that are used. One is sertraline, which is an anti-anxiety medication. Um, so that is sort of one of the first line treatments. But also, what we need to do is actually sort of flatten the swings in hormones. So, actually using a sort of birth control, so hormonal treatment to manage symptoms. So, just going on a pill, whether that's a progesterone and estrogen combined pill or a progesterone only pill. But they would be the first line medications. And then there are more kind of specialist medications as well that are used.
Great, thank you so much. We've also had a follow-up question which says, are there any alternatives to medication to manage PMDD, e.g. through therapy and particular supplements? Evelyn have popped in some more information about their products, but I guess alongside that, is there anything else that you would recommend, Katie?
Yeah, actually, what I should have said in the answer to the last one, I mean, usually we do talking therapies as well. So cognitive behavioral therapy can be really helpful with this. But I have to say, because the symptoms are so extreme, it usually does require actual sort of medication in combination with talking therapy. And a lot of sort of additional support, because this is absolutely interfering with normal life. So I guess, don't no one likes to use medications, and we don't give it lightly. But for something like this, which is preventing normal life carrying on and school absence, then absolutely needs to be treated with medications.
Yeah. Okay, we've got some other questions in the Q&A box. So this one is, I find it hard to bring up PMDD because I'm scared it won't go down well. It actually puts a strain on our relationship because she shuts me out and I'm only trying to help. What would
Hmm.
you advise?
Oh, that's so difficult. And I hope what we've said today has helped to some degree. I think um, sometimes you just can't, sometimes you just have to back off. If she doesn't want to talk about it, maybe you're, as hurtful as it can be, maybe you're not the right person to talk for her to talk to about it. Seeing if she would open up to someone else, a family friend, another relative, can be helpful. If she's got a big sister, um, just giving it time, giving her information actually, so empowering her, and again going back to sort of tracking her symptoms, and maybe not saying PMDD. It could just be, I've noticed that your mood just changes quite a lot before your period. And I'm worried that that's kind of really horrible for you. Um, have you read anything about it? Can we find some information together? Are you tracking it? And have you noticed any other changes in your body? I think just, or maybe moving the focus away from mood, switch it to physical symptoms. What are you feeling during this time? Rather than, I think sometimes if they just think you think they're being horrible and irritable, then that is an immediate sort of shutdown. So focus on the physical symptoms and see if that helps. I think it's just also a matter of just try different things. Don't give up. There will be a way that she'll open up. And if she doesn't, then she'll get on with life and it will be okay. But if it needs dealing with, that will come to light eventually.
Thank you, Dr. Katie. And yeah, I think that makes sense. Often, one of the points you mentions, teens want to hear it from someone else other than their parents. And that's where Luna sometimes comes into play, where they might have asked a question and Luna will say, this sounds like something you probably need to discuss with a doctor or a parent. And it does encourage that conversation. So that whole big sister coming into play
Absolutely.
Okay, this is a question around my daughter's cycle isn't regular yet. Should I be tracking it or just wait until it settles? She does have symptoms of PMDD, but should I wait for her period to be regular? I guess this comes back to what you were saying before.
Mm. Well, there's absolutely no harm in tracking it now. I mean, I would start early, because then you it'll start to sort of make sense, I think, and you'll be able to see it becoming more regular. So absolutely no harm in tracking it, or she should be tracking it,
Yeah.
um, just to sort of understand her body. Um, I do think that when at the beginning of girls having their period, in that time where they're having what we call dysfunctional uterine bleeding, so chaotic release of hormones, PMS can be a bit worse, because basically when they don't ovulate, that means the sort of symptoms for the next period are a lot worse. So the bleeding is heavier, the pain is worse, the mood is probably worse because of that. So, it can all take a little while to settle down. And that's why sort of tracking over a longer period of time is really important. So, yeah, to answer your question, I just start tracking symptoms, and bleeding, even if it's irregular.
Okay, we've got four more questions to go. How long should I wait before talking to a GP if I think her symptoms might be more than PMS or a typical teenager?
Yeah, well, again, I think I would probably go with at least 3 to 6 months of data. There's no harm in having the conversation with the GP or encouraging your daughter to, because this is all sort of practice, for having to have these conversations. So I hope, how we've talked about PMDD being something that is, these severe symptoms makes it a bit clearer distinguishing between PMS and PMDD. Um, and I think, even if it's PMS and they're missing school, then you should still go to the GP because they shouldn't have to miss school with their periods. I mean, that absolutely not. And hormonal medication isn't the only medication. There are other things. There are two drugs, tranexamic acid and mefenamic acid, which might sound familiar to you. They're used very commonly to control bleeding and pain, so they can be used first and foremost.
Great. Okay, this is an interesting one. Is there a link between endometriosis and PMDD?
Not that I'm aware of, actually. It's a slightly difficult area to go into, and endometriosis is complicated. Um, but what we do think does happen if periods are very heavy, and with lots of sort of erratic and prolonged bleeding during the adolescent period, then it may be linked to having endometriosis as an adult. So actually controlling the bleeding, whether that's on non-hormonal or hormonal treatment during the adolescent period, is really important. Not leaving it, I had to suffer with really difficult bleeding when I was your age. It just shouldn't be tolerated. It can be managed. And we also know there's an interesting paper came out very recently, in the Lancet, saying dysmenorrhea, so painful periods during adolescence, is linked to chronic pain in adult life. So again, another reason for managing periods during teenage years.
I think you answered this in your questions before, but I'm just going to ask it one more time. Who do I ask my GP for referral to? Is there such thing as a pediatric gynecologist?
There is. I am one. But as I said, there aren't that many, but ask your GP. They should know. If, obviously it totally depends where you live. But for example, in London, there are about three of us. So we are not very common. Um, so, but just inquire because there will be people around. And if not, then a general pediatrician or a psychiatrist, depending on the symptoms.
Mm-hmm, mm-hmm. Yeah, that makes sense. Do any forms of contraception help the symptoms of PMDD?
Yes, exactly. And that is the hormonal treatment. So, we use the combined oral contraceptive pill, that's estrogen and progesterone, and we use the progesterone only pill. Um, and it's a bit of a difficult one because it is also contraception. There's a lot of sort of misinformation and negativity around it. But actually, there are newer pills now, these third generation pills, which have much better side effect profile, um, and are tolerated much better. Um, we use them slightly differently than we did 20 or 30 years ago. So don't dismiss it. And just because your daughter is on hormonal treatment that is also contraception does not mean she is going to go out and have sex any earlier than she would anyway. That is a huge myth. So it does not encourage younger sexual activity.
Amazing. And then one last question before we say thank you to everyone. Oh, well, thank you to you, really, and thanks for everyone's time. Can the PMDD symptoms continue after the menstrual bleed is over, e.g., insomnia? Is this something you've seen?
It's rare. It's rare. And it kind of goes back to the point that a lot of stuff is going on during the teenage years, and insomnia is one of them. So I see many teenagers, girls and boys, with sleep problems during adolescence. So I would think it is less likely to be linked to hormonal, well, I shouldn't say the sort of menstrual cycle hormones, um, than if they're having sleep disturbance in the week after their period. Yeah.
Brilliant. Well, thank you so much, Dr. Katie. I'll hand over to Imogen, but from our side, thank you so much. Obviously, if you want to book an appointment with Dr. Katie directly, you can. Obviously, there's the Luna discount code as well that we'll send, and the Evelyn discount code too. But thank you all so much for the questions and for tuning in this Tuesday evening. Over to you, Imogen.
Thank you. Wow, what an amazing webinar. That was so, so good. I really, really enjoyed listening in there. It was so it's insightful, and I really hope everyone who joined us today, or if you're watching on the replay, feels the same. Obviously, I just want to say a huge thank you to you, Jess, and Dr. Katie, for sharing your time, your expertise, and all your advice that you've given us today. It's been absolutely amazing. And yeah, have a lovely rest of your evening, and a huge thank you one more time to Jess and Dr. Katie.